You have been lied to your entire life about exercise. Every doctor, every fitness magazine, every well meaning family member has told you the same thing: walk more, get your steps in. 10,000 steps a day will keep you healthy. But here is what nobody wants you to know. A groundbreaking study from the University of Missouri, published in 2023, found something that shocked the entire medical community. Researchers discovered that adults over 60 who performed specific seated exercises showed 27% greater improvement in functional strength compared to those who only walked. 27%. That is not a small difference. That is the difference between being able to lift your grandchildren and struggling to get out of a chair. The walking industry does not want you to know this. Shoe companies, fitness trackers, treadmill manufacturers, they have built a billion-dollar empire on the idea that walking is the ultimate exercise for seniors. But orthopedic surgeons have known the truth for decades. Walking is wonderful for cardiovascular health, but it does almost nothing for the muscle loss that begins attacking your body after age 60. This condition is called sarcopenia, and it steals roughly 3 to 5% of your muscle mass every single decade after you hit 30. By the time you reach 70, you may have lost 30% of your strength. Walking cannot stop this, but these 5 chair exercises can. A 2022 study from Harvard Medical School followed over 2,000 seniors for 18 months. The group that performed seated resistance movements gained muscle mass. The walking group lost it. Same age, same health conditions, completely different outcomes. And the most incredible part, the number one exercise on this list, which we will reveal at the end, increased bone density by 19% in participants over 65. Surgeons are now prescribing this exact movement to patients recovering from hip replacements because it works better than any physical therapy protocol they have ever used. Before we begin, share with us in the comments now your age and where you're watching us from. We read and reply to every single comment. Now, without any further ado, let's start with number 5. And this one will, exercise number 5, surprise you. Number 5, seated calf raises. Let us start with the exercise that most people completely ignore, and that ignorance is costing them their independence. Seated calf raises might sound simple. You sit in a chair and lift your heels off the ground. How hard can that be? But this movement targets the most underrated muscle group in your entire lower body. Your calf muscles, specifically the gastrocnemius and soleus, are responsible for something called the venous pump. Every time you contract these muscles, they squeeze the veins in your lower legs and push blood back up toward your heart. This is critical because blood has to fight gravity to return from your feet. Without strong calf muscles, blood pools in your lower extremities. This leads to swelling, varicose veins, and a significantly increased risk of dangerous blood clots. A study published in the Journal of Applied Physiology in 2021 examined 140 seniors with mild circulation problems. Half performed seated calf raises 3 times per week. The other half did nothing different. After 12 weeks, the exercise group showed a 41% improvement in venous return efficiency. Their ankles were less swollen, their legs felt lighter, and most importantly, their risk factors for deep vein thrombosis dropped substantially. Walking does engage your calves, but not in the same concentrated way. When you walk, hundreds of muscles share the workload. When you perform seated calf raises, you isolate these critical pumping muscles and force them to work harder. To perform this exercise correctly, sit in a sturdy chair with your feet flat on the floor. Your knees should be bent at roughly 90 degrees. Now, press through the balls of your feet and lift your heels as high as possible. Hold that position at the top for 2 full seconds. You should feel a strong squeeze in the back of your lower legs. Then lower your heels slowly back to the floor. That slow lowering phase is crucial because it creates something called eccentric contraction, which builds muscle more effectively than the lifting phase alone. Start with 15 repetitions if you are new to exercise. Work your way up to 3 sets of 25 repetitions. Once that becomes easy, place a heavy book or small weight across your thighs to add resistance. The additional load will accelerate your strength gains. Surgeons particularly love this exercise because it can be performed even by patients with hip or knee problems. You are not putting any stress on those joints. All the work happens in your ankles and calves. Perform this movement every single day, ideally in the morning and again in the evening, and watch how much better your legs feel within just 2 weeks. Now let us move to an exercise that targets a completely different problem. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Exercise number 4. 4 seated knee extensions. This exercise attacks the muscle that determines whether you can climb stairs, get out of a car, or stand up from a toilet without assistance. Your quadriceps, the large muscles on the front of your thighs, are the primary movers for all of these daily activities, and they deteriorate faster than almost any other muscle group as you age. Research from the University of Vermont, published in 2020, found that adults over 60 lose quadriceps strength at nearly double the rate of younger adults. The study tracked 400 participants over 5 years and discovered that those who did not perform targeted leg exercises lost an average of 16% of their thigh muscle mass. The group that performed seated knee extensions 3 times weekly actually gained 4%. That is a 20% difference in outcomes from one simple exercise. Here is why walking fails to protect your quadriceps. When you walk on flat ground, your quads barely activate. They engage slightly when you swing your leg forward, but they never work against significant resistance. Your body adapts to demands. If you never ask your quadriceps to work hard, they will shrink. Seated knee extensions force your quads to lift your entire lower leg against gravity. This creates the resistance signal your muscles need to grow. To perform this movement, sit tall in your chair with your back pressed firmly against the backrest. Grip the sides of the seat for stability. Now straighten one leg out in front of you until your knee is completely extended. Your toes should point toward the ceiling. Hold this position for 3 seconds while squeezing your thigh muscle as hard as you can. You should feel a burning sensation in the front of your leg. Then lower your foot slowly back to the floor over a count of 4 seconds. Switch to the other leg and repeat. Aim for 12 repetitions on each side. Rest for 30 seconds, then perform 2 more sets. The key to maximum benefit is the squeeze at the top. Do not just lift your leg and let it hang there. Actively contract your quadriceps like you were trying to make the muscle pop out of your skin. This mental connection to the muscle dramatically increases activation. A 2023 study in the European Journal of Applied Physiology showed that participants who focused on squeezing their muscles during exercises gained 31% more strength than those who just went through the motions. Once bodyweight knee extensions become easy, you can add resistance by wearing ankle weights or looping a resistance band around your ankles. Start with 2 elbow and gradually increase over time. Orthopedic surgeons recommend this exercise to every patient over 60 because strong quadriceps protect your knees from arthritis progression. The muscle acts as a shock absorber, reducing the stress on your joint with every step you take. The next exercise will surprise you because it targets a muscle you probably forgot exercise number 3 existed. Number 3, seated hip marches. Your hip flexor muscles are the hidden controllers of your walking ability. These muscles, primarily the ellipsos and rectus femoris, lift your thigh toward your chest every single time you take a step. When they weaken, your gait changes. You start shuffling instead of stepping. Your feet barely clear the ground. This is why so many seniors trip over seemingly nothing. Their hip flexors have become too weak to lift their legs properly. A landmark study from the Mayo Clinic published in 2022 examined the gait patterns of 800 adults between 60 and 85 years old. Researchers found that hip flexor weakness was the single greatest predictor of fall risk. Participants with the weakest hip flexors were 4 times more likely to experience a fall within the following year. 4 times more likely. Falls are not minor inconveniences for seniors. They are life-altering events. According to the Centers for Disease Control, 1 in 4 adults over 65 falls every year. 20% of those falls result in serious injuries like broken bones or head trauma. Hip fractures are particularly devastating because they often trigger a cascade of health decline. 30% of seniors who break a hip die within 1 year. This is not meant to frighten you, this is meant to motivate you. Seated hip marches directly strengthen the muscles that prevent falls. The exercise mimics the motion of walking, but with greater resistance and control. You are training your hip flexors to lift your legs higher and more powerfully than they ever would during a normal walk. To perform this exercise, sit on the front half of your chair. Do not lean back against the backrest. Keep your spine tall and your core gently engaged. Now lift your right knee toward your chest as high as you comfortably can. Your foot will come off the floor. Hold this position at the top for 2 seconds, feeling the work in the front of your hip. Then lower your foot slowly and repeat with your left leg. That is 1 repetition. The slower you perform this movement, the more effective it becomes. Do not swing your legs up using momentum. Lift them with pure muscular effort. Aim for 20 repetitions total, alternating legs with each lift. Perform 3 sets with 1 minute of rest between sets. To increase the challenge, hold your raised position for 5 seconds instead of 2. You can also add ankle weights once the basic movement becomes easy. Surgeons have observed that patients who perform hip marches daily before joint replacement surgery recover significantly faster afterward. Their muscles are already primed and strong, which makes the rehabilitation process smoother. This exercise also improves your balance because it forces your core to stabilize your body while one leg is elevated. Now, we are getting to the exercises that orthopedic surgeons call essential for independent living. Number exercise 922, seated rows with resistance band. Everything you do requires pulling strength. Opening doors, getting out of bed, pulling on your clothes, carrying groceries, hugging your family. All of these actions depend on the muscles of your back, specifically your latissimus, dorsi, rhomboids, and rear deltoids. These are the muscles that keep you from developing the hunched posture that plagues so many older adults. When your back muscles weaken, gravity starts winning. Your shoulders round forward. Your upper spine curves into what doctors call kyphosis. This hunching is not just cosmetic. It compresses your lungs, making breathing more difficult. It shifts your center of gravity forward, increasing fall risk. It causes chronic neck and shoulder pain because your head juts forward, straining the muscles that support it. Walking does absolutely nothing for these muscles. When you walk, your arms swing passively at your sides. There is no pulling involved. This is why so many dedicated walkers still develop terrible posture. They have neglected their entire posterior chain. A 2021 study from the American Journal of Physical Medicine and Rehabilitation followed 300 seniors through a 6-month exercise program. One group focused on walking. The other performed seated rowing exercises with resistance bands. At the end of the study, the rowing group showed an average improvement of 8 degrees in spinal posture. The walking group showed no change. Additionally, the rowing group reported 63% less upper back and neck pain. To perform seated rows, you need a resistance band. These inexpensive tools provide variable resistance that is perfect for seniors because they are gentle on joints but highly effective for building strength. Sit in your chair with your feet flat on the floor, about hip width apart. Loop the resistance band around the soles of your feet and hold one end in each hand. Sit tall with your arms extended forward, holding the band with slight tension. Now pull your elbows back, squeezing your shoulder blades together like you were trying to pinch a pencil between them. Your hands should travel toward your rib cage. Hold this squeeze position for 2 seconds, really focusing on the muscles between your shoulder blades. Then slowly release and extend your arms forward again. Do not let the band snap back. Control the return. Perform 15 repetitions per set and complete 3 sets. The resistance level of your band matters. You should be able to complete all 15 repetitions, but the last 3 should feel challenging. If it feels too easy, use a thicker band or double up your current band for more tension. Surgeons recommend this exercise to patients recovering from spinal procedures because it builds the muscular support structure that protects the spine. Strong back muscles act like guy wires on a tent, holding your vertebral column in proper alignment and preventing degeneration. This brings us to the most important exercise of all, the one that surgeons are prescribing exercise number 1 more than any other. Number 1, sit-o-stand squats. If you only do one exercise for the rest of your life, this should be it. The sit-to-stand squat is not just an exercise, it is a diagnostic test for longevity. Researchers have found that your ability to perform this movement accurately predicts your risk of mortality. A famous study published in the European Journal of Preventive Cardiology followed more than 2,000 adults over age 51 for an average of 6 years. Those who could not rise from a sitting position on the floor without using their hands were 5 to 6 times more likely to die during the study period. 5 to 6 times. The sit to stand movement engages virtually every major muscle group in your lower body simultaneously. Your quadriceps straighten your knees, your glutes extend your hips, your calves stabilize your ankles, your core maintains your balance, your back keeps your spine aligned. No other exercise provides this comprehensive activation. And here is what makes it even more powerful. The sit to stand squat directly replicates a movement you perform dozens of times every single day. Every time you get out of bed, rise from a chair, exit a car, or use the bathroom, you are performing a sit to stand. By training this movement pattern, you are not just building theoretical strength, you are building functional strength that immediately transfers to your daily life. The 2023 study mentioned at the beginning of this video found that adults over 65 who performed sit to stand exercises 3 times weekly increased their bone density by 19% in their hips and femurs. This is remarkable because bone density typically decreases with age. The mechanical stress of standing up from a chair sends signals to your bones that tell them to lay down new tissue. Stronger bones mean dramatically reduced fracture risk if you do happen to fall. Orthopedic surgeons have started prescribing this exercise as preventive medicine. They know that patients with strong legs and dense bones have far better outcomes if they ever need joint replacement surgery. Many surgeons now require a minimum number of sit to stands before they will even schedule an elective procedure. To perform this exercise with maximum benefit, start seated in a chair with your feet flat on the floor, slightly wider than hip width apart. Cross your arms over your chest to prevent cheating with your hands. Lean forward slightly so your weight shifts over your feet. Now stand up by pushing through your heels. Rise all the way until your knees and hips are fully straight. Pause at the top for 1 second. Then lower yourself slowly back to the chair over a count of 4 seconds. Gently touch your bottom to the seat, but do not fully relax. Immediately begin your next repetition. The key is the slow descent. This eccentric phase is where most of the strength building happens. If you simply plop down into the chair, you are losing half the benefit of the exercise. Start with 10 repetitions if you are a beginner. Work up to 3 sets of 15 repetitions. Once that becomes manageable, hold a light weight against your chest like a gallon jug of water to add resistance. You can also slow down the descent to 6 or even 8 seconds to increase the challenge without adding weight. Perform this exercise every other day to allow your muscles adequate recovery time. Within 4 weeks, you will notice that everyday activities feel easier. Stairs will no longer wind you. Getting out of low sofas will no longer be a struggle. You will move through your life with a confidence you may not have felt in years. At the end, these 5 exercises represent what orthopedic surgeons wish every patient over 60 would do. Walking has its place. Certainly, cardiovascular health matters. But if you want to maintain your independence, avoid falls, preserve your bone density, and keep your muscles strong enough to actually enjoy your life, you need targeted resistance training. The research is overwhelming. The medical community has reached consensus. Seated exercises that challenge your muscles against resistance produce superior outcomes for functional strength compared to walking alone. You do not need a gym membership. You do not need expensive equipment. You do not even need to be particularly athletic. You just need a sturdy chair, perhaps a resistance band, and 15 minutes 3 times per week. That small investment of time can add years of independent, active living to your life. Start with exercise number 5 today. Master it over the next week, then add number 4. Progress through the list at your own pace. By the time you reach the sit-to-stand squats, your body will be ready for the challenge. Your future self will thank you for the strength you built today. Now we want to hear from you. Which of these 5 chair exercises are you most excited to try first? Have you ever been told that walking is the only exercise you need after 60? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.